Now moving on to the musculoskeletal section. So I will just be asking the patient a few questions, and then I will just go into the assessment. Do you have any history of joint disease?
No.
Do you have any limited movement?
No.
Do you have any pain?
No.
Do you have any other problems with your joints or muscles?
No.
Okay, so I'm going to start with your temporal mandibular joint. And this is where I'm just going to have the client... I'm going to have the client stick their chin out.
Mm-hmm.
Okay. And just palpate at the temporal mandibular joint. And I'll have them move their chin from side to side. Okay. And when I'm doing this, I'm basically feeling for any clicking sounds, checking for movement and strength. Okay, and everything seems normal. And now, while having the patient stand, I will have them put their chin to their chest, which is called retraction.
Mm-hmm.
Okay. Turn to the side. And right here, I'm just palpating the spinal processes all the way to the 1C7, feeling that it is straight. Okay. And it is. Okay. You can sit down. Okay. And right now, I'm just going to go check for the range of motion in the patient's neck. So I will have the patient lower their neck into their chest, which is called retraction. And then I will have the patient look up. And I will have them rotate their head, which is rotation. And I will have them bring their head from ear to ear. Okay. And now I'm just going to check for strength and have my patient basically push their head into my hand. Push it there too. Okay. Okay. And the strength is normal and everything seems normal. Next, I will be moving down to the shoulders. You stand up. Okay. And right now I'll just be having the patient lift their shoulders against my hands. Just testing for strength. Okay? Okay? And it seems strength is normal. And now I will also just palpate the shoulders. Just feeling for any abnormalities. Do you have any pain here?
No.
Okay, and I'm just moving down their arms to their elbows. And down further to their arms.
No.
And then just going back up to their shoulders. Making sure that everything is normal. In doing this, I'm just looking for any signs of abnormalities, tenderness, pain. Okay. And now I will have my patient bend their elbows at a flexion.
Mm-hmm.
Which is bending their elbows, which is called flexion. Okay. Put both elbows out. And then putting them both out straight, which is called extension. And then having the patient turn their fist in a supination. Turn the fist into a supination position. And then pronation. And then I will check for the strength of your elbow, having the person in the flex position and having them pull their arm toward them while me holding it. Okay? So, okay. Good strength. And now I'll just have their patient lift their arms up. And this is called the circumference. So just moving the patient's arm in a circle and making sure that everything is normal. Okay?
Bye. Oh. Sorry.
Okay? You can put your arms down. And then I'll have my patient lift their arms this way, which is called abduction, away from the body, and then put them behind their head. And then I will have them bring the arms down, which is called adduction. And then I'll have the patient do this again forward, and this time bring their hands behind their back. So go like this, hands up, and put your hands behind your back. Okay? And that seems normal. Okay? And now I will have the patient put their hands out with their hands in a pronation. With their fingers out. And then I will ask the patient to face their wrist down, which is called depression. And I will have the patient bring their wrists back up, which is called elevation. Okay? Then after this, I'll have the patient spread their fingers apart like this, which is called abduction, and bring them together again, which is called adduction. Okay?
Okay.
And then I want you to put your hands out and depress only your fingers. So this one doit tout seulement. Comme ça. So depress your fingers and elevate them again. So depress and elevate. Okay? Now I want you to put your hands in a supination position with your palms facing up. Okay? And then I'm going to hold your fingers, and I want you to turn to the side for me so the camera can see. Put your hands out and curl your fingers in so I could, as hard as you can. So I could test for your strength. Okay? Okay, nice and strong. Now right here, I'm just going to palpate the hands and the wrist, making sure I'm checking every bone. And basically, I'm looking for any signs of enlargement, any abnormalities. Do you have any pain?
No.
Okay. And you want to do this in both hands. You want to make sure that you get every bone, because there's a lot of small bones. Okay. Do you have any difficulties with your wrists or your fingers?
No.
Okay. Okay. So now I will have the patient lie down, and this is where I will just be testing their hips. Let me adjust this. So, put your head over there for me, please. Okay. Now I'll be moving the camera closer. Okay. I'm just going to try to position the camera in a better position. Okay. Okay, so for the purpose of the video and positioning, I will just have the client stand up, but usually I would have him lay down just so you guys could have a better view. But usually this part is done with the patient lying down. Okay, so then I would have the patient lay back and I will palpate the sides of where the hips are. And I would ask, do you have any pain?
No.
Okay. Making sure. Okay. And then I will have the client, if the client was laying down, I would have the client bring out their leg, which is called abduction. It's like this. Okay. And bring it in again, which is adduction. Okay. And then elevate and depress the leg. So bring the leg forward and then bring it back down. Okay. And then you could do that with the other leg. Bring this leg out, called abduction, and bring it in, which is adduction. And then elevate it and bring it back down and depress it. Okay. And then I will have the patient bend their leg at the knee in a flex position. So you could do that. Let's see. Yeah. Okay. So you would just go like this. Okay. And elevate it and bring it adduction in. Adduction, which is in. Okay. And abduction, which is out. And bringing their leg back down, which is depression. Okay. And then you just do that on the opposite. Bring it in. Adduction, bring it in. Abduction, bring it out. Okay. And bring it down and depress. Now, usually that part is done laying down. But for the purposes of the video, I had the client stand up for a better view. Okay. Now, testing for strength, I will have the patient pull their leg out while I put my hand against their leg. So they would be pulling their leg out in abduction. So, so TPO. Okay.
Okay.
Okay. Okay. Okay, nice and strong. And do that on the opposite leg too. Okay, nice and strong. And then I'll have them pushing in, which is adduction. So put your legs, open your legs a little bit, okay? And bring this leg in, okay? Bring it in closer, which is adduction, okay? Other leg. Okay, nice and strong. Now I will move on to the feet and the ankles and the toes. So you could just sit back for me, all the way back. So I can palpate the feet. Okay. So while doing this, just checking for any abnormalities. Okay. And now I would have the client, checking for strength, I would have the client push up against my feet and push and pull their feet back up against my hands. So let's try to adjust the camera. Side view. Okay. So wapuse pio sumem. Okay. And pull back. Okay. And the strength is good. Okay. So the next thing I will have the client do is put their toes together and then back out. Okay, so let me get a better view. Okay, so I'm just les view. Yeah. Okay. Okay. Now I will have the client lift the inside of their foot up. So this inner part, and they're going to bring that part up, which is called inversion. Okay. So I'll put it okay? Okay. So do it again. Inside. Okay, that's inversion. And then I'll have the client lift their outside of their foot, which is this part, outwards, which is eversion. Whip you up comme ça. Outwards. On fait deux bossa au vidéo comme ça.
Ok, comme ça.
Okay, perfect. Okay. And then I will have the client sit back up closer. Okay, come closer. Okay, you can sit down. Okay. And then I will just palpate the knees. And ask the client if they have any pain in their knees. Do you have any pain?
No.
Okay. You have any pain in this one?
No.
Okay, you just want to make sure you know no masses, no abnormalities.
No.
No tenderness. Okay. And the next thing you want to do is have them extend their legs straight and then return them back to normal while they're sitting. So, update you pied droite. Okay. You can put them back down. Okay. And now I'm just going to check for strength. So 1 feet at a time. On seul pied, on seul fois, okay? Poussez le sous-pied. Okay, that's good. Next foot. Okay, nice and strong. Now I will have the patient stand up and extend their leg out as far as it can go and flex it as far back. So what you will do is extend it as far as you can go. Extend. In, okay, and you will flex it as far as it can go back. Okay, so turn to the side so they can see. Okay, and turn the other way and do the other foot the same way. Turn this way and elevate this foot and extend it. Okay, turn to the side and just flex it, which is also flexion. Okay, and then I'm just gonna go back to the posterior chest and palpate the spine, looking for symmetry of the shoulders and the scapula. And I will have the patient bend over, which is called retraction, and I should see a C curve shaped when bending over. Okay, I'm palpating. Okay. Now we'll have the patient bend over. So turn to the side for me, please. And just bend over like that. Okay. And there you can see the C-shaped curve when bending over. Almost like a little hump. Okay. And I will also check the range of motion of the spine by having them place the hands on the hips and turning side to side. Okay, and while he's doing this, I'm just inspecting. Okay, and that's perfect. And that about wraps up the musculoskeletal assessment.